sorry about that. My battery died on my phone. But the cool thing is, I'm actually rebooting with another battery because I'm a total crackhead and I have two. And a spare charger in the house because I'm a crackhead. But anyway, Blackberry, crackhead. Yeah, those of you who don't know. Yeah, so while my phone's rebooting, I'm gonna continue this video on my sister's phone. Thank goodness she's here. We have the same one. We're a bunch of dorks. So, yeah, I was talking about the pyloric sphincter and how the stomach and the throat are connected. The esophagus and the stomach are connected by this sphincter muscle, which is a circular type of muscle that will contract and work as seal to keep stomach contents down after we swallow and they enter the stomach. And even though nature has provided us an exit direction, like, it's not designed to work that way, except in emergent situations, like if you've eaten something toxic or are sick with a stomach flu or something, then yeah, vomiting is kind of a last resort function. It's not meant to be normalized. So, in condition like purging anorexia or bulimia, frequent vomiting can stress, strain, and actually dilate that muscle so that it can't close as effectively, and the end result is in the normal movement of your stomach, acid can be splashed up and get through that valve, which is what we know as gastroesophageal reflux disease, GERD. So yeah, stomach acid getting into your throat. As far as you saying you've had tests done, but they were inconclusive, I'm not sure what tests you've actually had done. In a situation like this, GERD is typically initially diagnosed based on dialogue with the patient, based on your symptom profile. A lot of physicians now will go ahead and do a trial of either an antihistamine or a protein pump inhibitor, which I'll talk about, and see if symptoms are rectified. If you're throwing up blood, that's more of a concern, that there could be more extensive damage. A little bit of blood in the vomitus can be just from rupturing a blood vessel in the airway or in the esophagus, which isn't good, obviously. If it's more profuse blood, if the blood is not bright red, if it looks more dark, it could be a situation where you have an ulcer forming, and that would require more extensive investigation, like an upper GI endoscopy, in which they put a little camera down your throat and will actually look at that muscle that's between the esophagus and the stomach and see if there's any visible anatomical damage, and can also proceed into the stomach and see if you've got any ulcerations going on. Ulcer meaning like the acid has eroded through the stomach tissue and caused an open sore, which is painful, and there'll be evidence when you throw up. So yeah, if any of those things are going on, you probably do need to have your situation investigated further. If you have not already tried medications, the three most common medications that are used for treating a condition like this are immediate acting antacids like calcium carbonate. Most common product is Tums or generic form. Maalox type Pepto sometimes. But again, I'm getting kind of digressing. But yeah, like calcium carbonate is your immediate neutralizer. And that can initially cause some burping because you are, there's actually gas released, hydrogen gas released when the acid is neutralized by the basic calcium carbonate. So, but then you do get some relief. It's usually limited, and the reason for that is you've got more acid coming, and again, the immediate acting antacids only take care of as much acid as they can neutralize right then. So it's not a long-term solution. For chronic symptoms, the best drugs on the market now are antihistamines, H2 antihistamines, H2 blockers, which actually will block histamine-mediated, I think, is it production? I need to look this up. One is production and one is release. I think this one is production. I'll annotate if I'm wrong. But it actually will attenuate the production of acid. It will reduce it. The other common treatment is proton pump inhibitors. Proton is like a alternative term for acid. So basically, the cells in your stomach that release the acid into the stomach chamber are suppressed by proton pump inhibitors. Drugs like Prilosec, which has an OTC formulation now, which is nice for people who don't have insurance. So yeah, those are like the two main defenses. As other tests are concerned, some physicians will test for H. pylori, which is a pathogen which can reside in the stomach and actually cause ulcers and problems. But I'm thinking, based on your history and current presentation, that your symptoms are probably related to your eating disorder. I can't remember if I said this the first part, or if it's part that got deleted, but yeah, I did talk about it. I talked about the anticipation and increased acid and anorexia. Okay, yeah. Two other issues that can worsen symptoms that are related to both anorexia and bulimia and related EDs is delayed gastric emptying. This can result from, in anorexics, a downregulation of the digestive system because not much comes through. Metabolic downregulation and compensation for not a lot of nutrition, just things slow down. This can cause some digestive discomfort as well. In the case of bulimia, your body becomes accustomed to losing its stomach contents. So, the whole process of remembering how to break down food and move it through the gut can be affected. And so delayed gastric emptying is a problem that can commonly occur with eating disorder patients. This is typically tested. You go into the lab, you have a certain meal composed of certain things, and then they evaluate how quickly that food will move through your system, if that's suspected to be a problem. But most of your symptoms sound GERD related for sure. If you have not tried a medicine to help you, then I certainly would consider trying either an H2 blocker or a PPI, a proton pump inhibitor. As far as stopping purging, I don't know if you're a member of my website, but I do have both binge mitigation techniques and mindful eating technique, the slow, safer, stop method, which can help you eat more mindfully, derail a binge, get back in touch with feelings of satiety, fullness. There's a whole bunch of different therapeutic approaches. I just shared some things that helped with me. I used to have binge eating disorder, pretty bad, COE. So I'm familiar with that almost autopilot sense of just eating everything, and it's definitely a very difficult cycle to break, but you can get out of it. I did. Unfortunately, I went too far in the other direction, but I've climbed back to a balance now, so that's a good thing. So yeah, check out those resources. I'll make a plan. I'll make videos of them so people who aren't on my website can benefit also. So I hope some of this was useful. If you have any more questions, please don't hesitate to ask. And let me know if any of this helped you. So I really hope this helped. Bye. And anyone else has questions, ask me and I'll do my best to answer. Love everyone. Be well.